So the next is horizontal flexion 1. So what you're going to do is instruct the client to go ahead and bring the arm up, one arm up. Let's have their right arm up, right along here. What you want to do is you want to grab right along their bicep, their upper arm, right on their bicep or tricep. And what you want to do is you want to have them bring the arm across their body, okay? You're going to be standing opposite to the side you're stretching. So right now I'm stretching Jacqueline's right arm. I'm standing on her left side, so I'm pulling her arm towards me. And then the last missing component here is I have my opposite hand here, stabilizing her opposite shoulder in order to prevent rotation of her trunk. Because if I were to let go of my hand here, there would be that compensatory rotation of her trunk as I'm trying to stretch it. So again, one more time, pulling across her body, holding it for 1.5 to 2 seconds, and back. 1.5 to 2 seconds, and back. The next stretch is going to be the triceps brachii assisted. So what we're going to do is instruct your client or the caregiver to bring one arm here behind their head, reaching towards their opposite side scapula. Okay? So we're going to instruct the client to do that. What you want to do is have one hand right along their tricep, the other hand here stabilizing the opposite side shoulder. You're going to instruct the client or the caregiver to apply gentle pressure for the client to reach back behind towards the opposite side scapula. So this is the right side. I'm instructing Jacqueline to try to bring her right hand down to her left scapula, holding for 1.5 to 2 seconds, then relaxing. One more time. Relaxing, one more time. Relaxing. Okay. The ninth stretch we have here is shoulder forward elevation. It's a pretty simple stretch. All you're going to have your client instruct your client to do, you can either just bilaterally or unilaterally. Let's do bilaterally here. So you're going to instruct the client to bring their hand, one hand up, one hand down. What you're going to do is come from behind them, grab right on their biceps, and you're going to pull back towards you, holding for 1.5 to 2 seconds, relaxing. You can keep the same side like this, or you can alternate between sides, bring it back like so, bring it back, 1.5 to 2 seconds, bring it back. All right, the next one is the shoulder sideward elevation. So what this entails is you're going to instruct the client to bring one side up as high as they can over their head. And what you want to do is, again, use the opposite hand here to stabilize the opposite shoulder. Grab right on their bicep region. And you instruct the client, it's a very, very small range of motion, but you're going to instruct the client to bring their elbows back behind the plane of their head, holding for 1.5 to 2 seconds, and back. Okay? Back behind their head, 1.5 to 2 seconds, back, 1.5 to 2 seconds, and then back. Okay. So this is a very, very important stretch. Make sure to understand this concept. All you're doing is instructing the client or the caregiver to help the client bring their elbows with a slightly extended hand behind their head and have them go across behind their head like that. Okay? Number 11, lateral trunk flexion seated. Okay, so for the stretch like this, as any sort of trunk flexion you're going to be doing, you want to remember the sideward elevation stretch. So for the very beginning, what we're going to do is instruct the client to bring their hands up, extended up behind their head, like so. And what you're going to do is you're going to instruct the client to lean towards one side laterally, towards the ground. Okay. What I'm going to be doing as a caregiver is stabilizing the opposite side hip so that the client's glutes do not lift up over the seat. Back up. Alternatively, you can also facilitate more of a stretch by instructing the caregiver to put some stretch onto the rib cage and back. Facilitate more of a stretch and then coming back. So the clients are moving laterally. They should feel it as they come down, feeling that stretch on the side, opposite to where they are stretching toward. All right, so the next stretch is the anterior oblique trunk flexion. So again, we're going to instruct our client to rotate their trunk, keep their legs, lower extremities in a fixed position, rotate their extremities or their upper body, their trunk at a 45-degree angle. So I'm instructing Jacqueline here, she already did it for me, at a 45-degree angle. And what you want to do is you want to have one hand coming up in sideward elevation. We're going to instruct Jacqueline to bring her other hand here, down in between her legs, reaching down towards the middle of her right foot. So what we're going to do here, we're going to have Jacqueline come down. She's going to go ahead and with her body nice and at a 45-degree angle, reach down towards her to feel a nice stretch in her posterior region here. And back, down, and back. Good. One more time. So you get the anterior oblique movement. The last stretch is the posterior oblique trunk flexion. So for instance, if we're going to have Jacqueline, again, at a straight, the lower extremities are straight, the rest of her body is straight. We're going to have her turn 45 degrees to one side. So let's say we're going to turn her 45 degrees to the left. We're going to instruct Jacqueline to get into sideward elevation here. Okay. Her other hand is going to reach towards the back side. If it's a four-legged chair, the back side, the back foot of the chair, like so. What I'm going to do is, again, as a caregiver, is stabilize the opposite side in which she's stretching to prevent her hips and her glutes from rising off the chair. Okay. So with her body turned at a oblique angle, she's going to be going backward posteriorly to stretch the anterior portion of her trunk. One more time. Again, being able to facilitate more of a stretch, coming back, stabilizing the hip, and going forward.
Is that all?
Yeah. Okay. That was 15 minutes.